So it's all about behavior, and I think that's something that everybody in this room agrees. And a lot of times the technology has been trying to find a way to create the connection. But what you're seeing is the connection is already. You're building a business based on the assumption the connection is already there.
We're leveraging the technologies that people use today to already connect and introducing software into those.
So is Jay Sanders in the audience? Okay, yes. So I didn't hear your panel this morning, but I heard somebody saying that you gave a talk about how 33 years ago you said the same thing that I just said at the beginning about, it's compelling and it's on the verge and it's all down to reimbursement. But I want to throw out something there, actually the solution to the whole reimbursement issue that has been holding everyone back is free. And the reason why I say that is if you look 5 years forward and you look at how the cost has already collapsed on the consumer side for all of this technology down to where it's becoming ubiquitous and everybody has some kind of connectivity device, even if they're living in, rural, remote, third world countries. They are connected already and texting each other because that connectivity has happened. So 2014, we probably can assume everybody on the planet is connected in some way, and we don't need to ship the screen to make that happen. So when I say free, a lot of the things we spend a lot of the money on now, maybe we don't need reimbursement for them because everybody already has them. So what happens to the business, to your business? Now you might have already answered this a little bit because Terry already described moving to services, a services model. But if you take out the whole necessity of actually being the one to do the heavy lifting to create that last mile, if that last mile is already there, how is your business then?
Well, I think the platform for, if that was, everything existed to reach out to the patient, there's still going to be the information that you want to send out, the information coming back and what to do with it. And, around that's going to form applications. So, we've already looked at, the future where, the device is already in somebody's hands, the connectivity to the healthcare system exists, but it's all about being able, the services to customize the workflows and to provide access into that pathway from applications and content developers and folks such as this. And that could be a potential future way to drive the business model, 4 or 5 years down the road.
So if you're making investments now in your sort of like your 5-year plan for your company, are you still investing in hardware and devices, or are you investing more in software and services?
Well, we're investing in both. The devices, we believe that there's always going to be patient populations that require, a specific device, but we're not, we believe that the majority of our connections, 4 or 5 years out, will be through other devices, other than ones we build.
So as somebody who's building a lot of those other devices, or enabling a lot of those other devices, I want to go to Don just ask you to kind of chime in on this, because there are a lot of really big companies that have entered this field. Honeywell and Bosch and Intel and GE and all these huge companies in this field, but who are going to be the surprising new entrants that disrupt some of those plans in your world, Don, when everybody's connected?
So in one example of that is a different answer to what's free. You were talking about kind of free being the connectivity that's free, and there's an interesting example out that has come in the bookstore marketplace in the form of Amazon's Kindle. So you buy the hardware, it's a unique piece of hardware. It follows the thinking that we will always find new needs for unique pieces of hardware, but it's not a subscriber device. It's not something you subscribe to, and that's because Amazon's paying the subscription cost, because what they've sold you is not an ebook reader, but a bookstore. And you've inadvertently bought a bookstore, and then of course they're making money every time you buy a book, a magazine, or a newspaper. And that concept can be applied to healthcare. We actually label that the Kindleization of healthcare as an umbrella, and we put it under a category we call personal supply chain management. And if you think about how a number of products in healthcare have disposables, consumables, or pharmaceuticals in them, where there's a very strong connection between a manufacturer and wanting to sell more of that product. So if you think about now how your inhaler might also be the product reordered and distribution manager, and not just an inhaler, not just a pharmaceutical, but actually part of a system, and that system marries the manufacturer to the end consumer, something they've never had in a relationship, then as a byproduct, you get the clinical data for free because you've gotten the reorder functions and the lock-in on that reorder. And so that concept I think we're going to see go on. We use the metaphor, it's kind of like putting the reorder button on the razor blade handle. And if you can actually get that in at the point, and here's the interesting part, is the technology to do that is now at the price points where you could actually put the reorder button on the razor blade handle.
And in some ways, it's like what's happened already in the consumer side with iPhone and Android, is that a lot of the old middlemen in the business have been completely made unnecessary. And so people that actually are creating something unique have a much more direct connection to the end user. I mean, so both Sandra and Randy, I think, are doing more kind of consumer-oriented, or anticipate more of a consumer-oriented selling to the consumer. And I wanted to ask Sandra, why are they buying, and also what in 2014, and Randy, what is the secret sauce to changing behavior, if that's what people are buying?
You know, one of the things in you were asking the question earlier about what people are really investing in, and I think that for us as a traditional health system, one of the things that we're investing in is better understanding the consumer, quite frankly, because in order for us to understand how to change behavior, we also have to understand how they live their daily lives, and how do you integrate a solution into a daily life in such a way that they'll actually engage with that solution and begin to change some of that behavior. Having said that, I think that, I'm sorry, what was your original question? I had to get that out.
So consumers are, more and more of it is private pay.
Private pay, yes. And what are they going to pay for?
What are they paying for?
One of the things that we've done is, and I knew there was a reason it was connected. One of the things that we've learned actually, and what people will pay for is, and we've all heard of this from business school, is where there's pain, there's gain. And the question is, where are the pain points that people would say, I would do anything if I could just resolve this issue? And I know in one of the earlier sessions, people were raising their hands if they were taking care of a loved one. And let's just do that again right now. How many of you are taking care of a loved one in some way, shape, or form? A significant number of you. And if it's your mother-in-law or father-in-law, you're saying, I'll do anything that I can to keep them out of my house, kind of thing. So what we've done is understand what are the causes of concern that they have most. Is it managing a medication? Is it staying safe? Is it knowing when they've fallen? What are those things that they're willing to pay for? And then we've in turn looked for the technology and the solutions to meet those needs. And then how does that actually integrate into a traditional health system? Some of which is beneficial from a traditional reimbursement standpoint. Many of the solutions are not. But people are willing to pay because they have either suffered from having to deal with some very fearful situations to actually having their lives change because they're trying to take care of someone else. So where there's pain, there's gain, and that's where we're focusing our efforts.
Secret sauce on behavior change. I actually think it's more complex than just to focus on consumers. It starts with an endorsement by a trusted relationship. So in our view of the world, I think a lot of that time it's going to come from a provider, somebody who they have a relationship with already today. So I do think that an endorsement of remote monitoring from physicians or nurses to the patient is going to be a key first step in changing behavior to get them engaged, to Sandra's point. Number two, it's got to be incredibly simple. If it's more complicated than what they already do today, forget it. You'll never get them started on the change path. Three, it has to be daily. It needs to be routinized or mechanized in their life. What we've learned is all of us in the room do something uniquely every day. We all brush our teeth, for example. We all check our Blackberries in the break time. There are things that we all in the room do every day because we do it every day. It's now a rote activity. So the key is reducing monitoring activities and behavior change activities to that same kind of rote level daily routine. And then lastly, I think it's all about the data. At the end of the day, I don't think you have to deliver any of this for free, although certainly a lot of what has been done in the past could be done for free or for less expensive alternatives.